Welcome to Coffee with the Supervisor. Today's topic is Lyme's disease, and I am joined by two very well-known experts, Dr. Anna Satalino, who is a psychologist,
Yes.
and Eva Haughie, who is the president of the Empire Lyme's Disease Association. Thank you, ladies, for joining us to
Thank
talk
you.
about this topic that affects a lot of people. I, for one, have had Lyme's disease twice, but there's a lot of people that I know who have had Lyme's disease. And it's not only a problem here on Long Island, throughout New York State, throughout the United States, and throughout the world. And my understanding of all the Lyme's disease cases in the United States, number one is New York State.
Yes.
It varies depending on the statistics for year by year. So what we say is New York is, according to the CDC, goes under the heading of highest incidence. So there are other states, and because of how awful Lyme can be, sometimes people from other states say, "Oh no, my state is worse," but it's bad all over, and it's bad in Europe and across the world.
There's 300
Unfortunately.
strains worldwide.
Yes.
Wow. Now, tell us how we contract Lyme's disease.
Well, a tick, or they say also any type of insect can. They are actually seeing spiders can.
So like a spider even,
A spider.
but
or
mostly ticks.
Mostly ticks, but they say deer flies and etc. So it can be a lot of different insects depending on what animal the insect may have contracted Lyme from. It's in the first place, and then it comes along and bites us. But
Some of the biggest carriers of Lyme's disease here on the
the
island
ticks.
are deer
deer,
Yes.
ticks,
and mice.
Yes,
Well,
and
the mice-
birds
the-
too.
And birds. Right.
Birds
Right.
are the hosts for the ticks, and then we become the hosts for the ticks also. And the mice, the white-footed mouse,
Right.
carries Lyme, and so do other animals. And so the ticks pick it up, and then they give it to us. How nice!
And there's different types of ticks.
Yes.
Yes.
And
You've got the deer tick, you've got the Lone Star tick.
Yep.
What are some of the other ticks
well,
out there?
there's a new one,
the wood
too.
tick. There's
Right.
a new one. Okay. I did a presentation once where I looked into this tick issue, and there are like over 800 species of
Whoa.
ticks throughout the world. Now, when they say, well, we only have two types of ticks that can infect you here, or 3 someplace else, or they think the CDC names maybe 3 or 4.
Mhm.
But the fact is, the question, have they really tested all 800 species, and do they really know that it's 800 or maybe 1,000?
Yes.
Science is only good up until the moment where they say, okay, we have 800 ticks that we know of.
Mhm.
And so,
So they
we don't
sampled,
really,
you say they haven't done enough. Now,
they
I
can't,
understand.
I don't think they ever will be able to
Right.
really tell the whole story.
I understand years
That sounds
ago,
awful, but I'm sorry.
many of the doctors and scientists never thought that Lyme's disease or tick-borne diseases were a big issue.
Mhm.
And oftentimes, people that had these symptoms that were suffering from a tick bite were misdiagnosed.
Yes.
And what were some of the things that what were they
Misdiagnoses.
Yeah,
MS, Parkinson's, fibromyalgia, chronic fatigue syndrome, Alzheimer's disease,
Yeah.
depression. The list goes on because Lyme disease is known as the great imitator.
right.
They
Because
even
it could be a
say-
couple of, so a lot of people, I'm talking 10, 15, 20 years ago, poo-pooed
Yeah.
Lyme's disease as a diagnosis.
Mhm.
Very difficult to diagnose and attribute it to everything else. And the funny thing is, correct me if I'm wrong, the quicker you get treated, the better off you are. So by misdiagnosing it,
Yes.
they did these people that were afflicted with tick-borne disease no favors.
Absolutely.
And the other problem with that is that when you get diagnosed with an autoimmune disease, which is what lupus, ALS, and all that, when you get diagnosed with them, they typically have prescribed steroids.
Yes.
And steroids suppress the immune system, and therefore if you have any infection, and you can see the ads on TV
Right.
where it actually says, don't take this if you have any, if they usually say TB, but you shouldn't take a steroid if you have Lyme or tick-borne disease, because
Right.
those are infections, and your immune system should not be suppressed if you have an infection. And that's the real damage too, because people who were previously diagnosed with misdiagnosed, and then they find out that they have Lyme. The worst thing for them was being misdiagnosed because the treatment is so counter to what you need for
Yes.
Well, we're going to put up at the end of the program numbers that people can contact for the Empire Lyme Disease Association and any other numbers that you think would be helpful for people. But besides being misdiagnosed, there's a debate about treatment with the doctors because some doctors have said, when I got Lyme disease, I got the standard treatment, which was 28 days. Very fortunately, I had two very good doctors. One had passed away, unfortunately, but they immediately took, I developed a rash in both cases, and they took which doesn't always happen,
No.
and they looked at the rash, it's a bullseye rash, so it was a typical thing, and they immediately put me on 28 days of antibiotic. But that was the standard, and that doesn't work for everyone. And there are some people, because it's taken longer to diagnose, that when they're given treatment, 28 days of antibiotics is not sufficient.
Yes.
And let's talk about that, because I think one of the people here sitting here today, Eva in this case, didn't get treatment when she contacted, and you've had it multiple times.
Yes, but the thing is, I'm here because I actually consider myself fortunate because I have had some good doctors, and at least I know what I'm fighting against with my own body. The little microbes in my body, I'm fighting them, and I know what it is, and I have not been really misdiagnosed. I was late diagnosed,
Right,
for
late diagnosed.
4.5 years,
Right.
but during that time, no one said take a steroid. I was given, they thought I had a sinus infection. I was given pills, medicine for a sinus infection. I even went home, they said it could be the dust in my house. I was cleaning my radiators with a Q-tip because I didn't want the dust, because I was convinced that, my headaches may have been from the dust. But the worst thing about the lack of knowledge about this, or the lack of recognition, forgetfulness, whatever it is on the parts of doctors, is that with your case, you probably only contracted Borrelia, and it was probably a Borrelia that was okay to treat, that could be treated. There are, as you said, 300 strains. Supposedly, according to the science, only 100 strains are actually infective, and Benjamin Luft, Dr. Luft, did a
Who's on the Suffolk County Board of Health, by the
Yes.
way.
okay, he did a study years ago, and he suggested that from his study that out of 16 strains of Borrelia, we have 4 of them here.
Mm-hmm.
So there are numerous strains. Unfortunately, the testing only tests for, I think, 3 strains. And so a lot of it falls through the cracks. But the thing that really is important to remember is that there are so many co-infections. And there have been tests and studies done, I should say studies, where they have determined certain co-infections exist here, Babesia, Bartonella. I have
Babesiosis.
babesiosis. I have
Rocky
at least
Mountain.
9 co-infections with counting Lyme disease. I have like 8 others: Mycoplasma, Bartonella, ehrlichiosis, anaplasmosis, etc.
It's a garbage pail of
Let's say you're the
diseases.
average person out there. What are some of the symptoms of Lyme disease or other tick-borne diseases that people might be experiencing? They've gone to the doctor, they haven't diagnosed as a tick-borne disease, but they're having these symptoms, and maybe they should look further. What types of symptoms would they come down with?
Well, I also just want to say before that is that with the bullseye rash, less than 30% of the people get that rash.
Right, so you may not, I was lucky twice because I got the bullseye, but you may not get the bullseye.
Yes.
You may not get a warning that is like, whoa, okay. So, you may not even see the tick
Yeah.
because the
See,
tick may
most
drop
people
off.
don't.
The tick,
Yes.
the
Right.
tick can
Yeah.
drop off. You may not see it. It could come off when you're scrubbing in the shower.
Right.
And if a rash is on your back or on your scalp, you're not going to see it even if
Right.
you do get it.
Right.
But the rashes can also be different rashes than
Yes.
bullseye.
Atypical.
And it also can depend, like with Rocky Mountain spotted fever, you get a spotted rash.
Right.
And so it's hard to actually, there's a lot of confusion. There's
Right.
just so
But
much
what are the
confusion.
types of
So,
symptoms
okay, so
that you might suffer?
a lot of times people say they feel like they've had the worst flu of their life.
So a flu,
Flu-like
headache,
Flu-like,
yes. Sometimes people
muscle weakness.
Yes. joint pain.
Pain.
Could be gastrointestinal issues as well.
And it can hit your
Migraine
organs.
headaches.
It can hit your organs, and I always say, this is one thing I always say because I know, because it's happened to me, so I can't be the only one. Lyme disease and these other tick-borne diseases, just like any other illness, but it might even be a little bit worse with Lyme. It can hit you from the top of your head to the tip of your toes, and it can cause pain in any part of your body.
Right.
Any part, and pain and numbness, because I thought I had sprained my 3 toes on my left foot, and I walked around thinking that I had sprained them somehow for about 3 weeks until it went away, and then I realized that was from Lyme. And
Right, because anything could happen.
Yes.
You
Right.
can get any
Psychiatric
kind of
too.
really weird physical pain or numbness. Numbness is a big thing. It can cause heart problems, and if it does get to the heart or the liver or a very important organ like that, it can be fatal.
It
Or
can be
can-
it can
be
damage those
fatal.
organs for sure.
Yeah.
Yes.
The second time I came down with Lyme disease, I don't get headaches. I got one of the worst headaches, and I went to the doctor's office. He wasn't in, but his physician's assistant was in, and they were concerned, guy's having a stroke.
Right.
Sure.
Right.
So they got an ambulance.
Oh, gosh.
I wound up in Peconic Bay Medical Emergency Room, and I'm saying it could be Lyme's, because having
Yeah.
spoken
Thank
with
God.
you in the
Aw.
past, forewarned,
Well,
forearmed,
see,
Thank
I
God
got
and
you
they
do.
wanted to do a spinal tap, and I'm like,
Oh,
Oh,
no.
God.
no,
Yes.
no. I said, do a blood test. Well, they did the blood test, but it took 4 days to come back, and sure enough, it was Lyme's.
Good.
But I said, start me on antibiotics right away.
Mhm.
So I started. But what are some of the headaches, muscle
Yes.
pain, weakness, fatigue? What are some of the other
Well,
things?
the psychological, which you
yeah,
should talk about.
psychiatric symptoms that people get, anxiety attacks, severe depression.
Right.
People even get symptoms that mimic schizophrenia,
Mhm.
and they have delusions and hallucinations. So there's also a lot of misdiagnosis with mental health professionals also that don't
You
know
could
what
see
is-
how this disease could be, to a physician, extremely troubling to
Yes.
spot, because it seems like so many other things, either psychological or physical, that could present itself.
Yes, and that's one of the biggest issues also, because the CDC recommends diagnosing Lyme disease on a clinical basis. So that's getting somebody's history,
Right.
have they been in Lyme endemic areas, and what is the clinical presentation that's going on. But what happens is that most of the physicians just diagnose by the blood tests, which are very unreliable, as we know. And if they don't
Both
have
mine came back positive, fortunately.
Yes, that
But a
was-
lot of people, that's not always the case.
Yes.
Blood test alone. So this is why this disease is extremely confusing
Yes.
to address and get treated.
Absolutely.
And what happens if you don't get treated?
Oh, you want to take it?
Well, I'm asking someone
we'll
that-
both
that-
answer.
Well,
it.
Was
you know,
misdiagnosed
there's a
and-
lot of talk about Lyme disease being chronic, and I don't like to think that way because I'd like to think that someday I'm going to feel better. But the thing is, if you don't get treated, or even with treatment, if it's not enough, or if it might be hitting the wrong thing, if you have a number of different tick-borne diseases like I do, you can wind up being partially disabled, totally disabled, and bedridden, and it can be fatal. There are a lot of fatalities, and one of the problems we have already
Yes.
talked about, and we were on another TV program actually, Dr. Satalino and myself talking about suicide.
Yes.
And I myself was suicidal for 4 years.
Well, when you
4
have that
years.
type of illness and it doesn't go away and it only gets worse and you're afflicted by that, it obviously could cause depression and suicidal thoughts. Now, you mentioned Dr. Luff, which is he's a physician with Stony Brook. He's also on the Suffolk County board. What other doctors out there are
Well, I don't know if he
experienced?
treats or not. I don't know.
No,
That's
no, I didn't say he treats.
Yeah.
But are there
Well,
doctors that people should see?
Sure.
Are there experts in the field? Like I know if I break my leg or something, or I'm having trouble with my knees, I go see an osteopath.
yes.
Who would I see for Lyme?
Yeah, unfortunately,
Eyelids,
one
right?
reason why Dr. Satalino and I want to, talk with you is because in Suffolk County and Long Island, people will ask us about doctors, and unfortunately, right now, we have a real scarcity of doctors who will treat Lyme.
Who are expert in tick-borne
And I think
diseases.
a lot of them are gonna say, look, you may have Lyme disease, but I don't know enough about it, and they're not, and it's so confusing. The main thing, though, is for a person to get treated, and then they can search out doctors if necessary, and there are doctors out of state and upstate New York, and there are many really good ones. There is, ILADS is
website.
the International Lyme and Associated Diseases Society. They will refer you to a doctor, and usually, you know, I will refer you to a doctor.
We'll
if
put
I
up their
can.
web address
Okay,
at
great.
the end of this program, and I understand all of that because this is a disease that afflicts a lot of people, and learning where to go is very important.
Well,
And one of the things that we talked about.
there
when I
aren't
was
enough places to go,
Right.
and I really have to put out a real urgent appeal to doctors to consider this. The CDC has suggested a clinical evaluation of symptoms and consideration of risk factors first and second, and blood test results should be only used as a distant third consideration. And the tests are inaccurate in some cases.
Yes.
And it's because, you know, if you have a whole bunch
False
of
positives.
co-infections, well, false negatives, but if you have a whole bunch of co-infections, that can really confuse the test results too. Because maybe there are, you know, they're looking for Lyme, but maybe there are all these other things, and so it just gets, you know, it gets confused.
If your immune system is compromised, you're not gonna come up
Oh, yeah,
positive either.
There are actually 20 reasons why the test can be inaccurate. One thing is that Lyme does not have to exist in a high population. The Borrelia bacteria itself does not have to exist in your bloodstream and in your system in a high concentration. So therefore, these little numbers, you know, they're scattered all over, and they might not show up in a blood test. You have it, but they might not even show up because there's not enough of them. But there are enough of them to make you sick.
Wow.
Now, this is the
That-
symptom list. This is a short symptom list.
That's a symptoms list.
Yeah.
And what
And
would,
there are 44 things listed, and I even, to make it a little bit, you know, with the eyes, I actually say, you know, this and this, the eyes can be one symptom, but you can have floaters, you can have blurry vision, you can have, you can go blind.
Well,
So,
when I
but
was
I
a
put that
county,
as one
right.
out of 44.
When I was a county legislator, one of the things that we worked on is we had a Lyme's forum
Mm-hmm.
uh,
Oh, yeah.
on Lyme's disease and tick-borne diseases at the Riverhead County Center. I'm happy to work with Al Krupski or Bridget Fleming or other county legislators and the Suffolk County Department of Health in offering town hall
Good.
in
Thank
Brookhaven
you.
Town,
Oh, that would be
because we
wonderful.
see a lot of people
Great.
to come here and one evening, maybe a 2-hour session, to have some panel experts speak about Lyme's and more importantly, answer questions
Answer
for
questions
people that
from
would come.
people, yes.
So, if you can get the county legislators and the
We
health
will.
department
Yeah.
to
I think
agree,
we can.
Yeah, we
I'm
will.
happy
We
to
will.
host this meeting.
Okay, thank you.
And willing to host it. I don't want to run it, but the legislators and the health department should. But I want to thank you for coming on this program. It's very brief, but hopefully those people listening are going to take a serious look if they're having some of these symptoms and say, if they don't go away and if I'm getting treatment but I'm not feeling better, maybe it could be a tick-borne disease that's masking itself
Yes.
in the symptoms of another disease. But by coming on today, Coffee with the Supervisor, and making people aware of this, I deeply appreciate this.
Well, we
And thank
appreciate
you
your
for
help
that.
all
Doctor?
throughout the years, so many
Right.
years.
Eva, thank you very much.
Thank you.
And I'm sure we'll do a part 2 of this maybe in the spring
Okay.
Sure.
when the ticks who never seem to die come
They
back to
don't
life.
die. They
Yes.
live to 17 degrees below Fahrenheit,
Right.
They're
according to
around all
National
year now.
Geographic. One thing is prevention, of course. You want to do everything you can to prevent tick bites. You can even look it up on our website, which is Empire State Lyme Disease Association.org, and you can see all different ways you can prevent tick bites. But you know, that's one way, but we don't prevent them. You know,
No.
it's obvious the incidence of tick-borne diseases is high, and the thing is to get diagnosed with everything that you might have so that you can get treated, and you can figure out sometimes your own treatment. You can discuss it with the doctor, but you really need to treat what's wrong with you,
Yes.
you know.
Well, Doctor, again, thank you for
Okay,
coming
thank
on.
you.
Eva, thank you so much.
Thank you.
And let's be aware of Lyme's disease. It's all around us. Let's be aware of its symptoms. And if you think you have it, let's get it checked out, because the longer you have it, the more damage you could do. And thank you for making us
Thank
aware.
you.